Hey everyone, this is the Narcissist I'm Asking for a Friend podcast. My name is Tyler King. This is my co-host Karen Maldonado, and we are here just giving you the scoop on the narcissism in relationships. Now, just so you know, we are not a narcissist bashing session. We do come at it from a Christian perspective, so we're doing it from a place of healing, place of awareness to make sure that if you're in these relationships, you know how to deal with the emotional ups and downs so that you can maintain your emotional health, right? So, Karen, we have something going on today. And I know with you, having that background in marriage and family therapy, you have had so many clients. But one of the things that we have never talked about was what do you do when you are dealing with a narcissist and you notice that there are some other things that are going on, maybe some other mental health issues, maybe some other like co-occurring behaviors that you're noticing that's happening with them. So Karen, if you can kind of shed some light on that to our viewers that may not even be aware, like, hey, there's another issue going on that's just as bad.
Right. And actually that could be helpful in this situation because we already talked about how narcissists are not going to want to go to counseling based on the fact that they're narcissists because they don't think that the problem is their problem.
Yeah.
If there's a co-occurring diagnosis like depression, let's say,
Yes.
um, in that kind of situation, then they may be willing to go for help with their depression because
Right.
that doesn't make them feel like they're to blame
Right.
them or whatever. So that may be a way to get that person's foot in the door for counseling. And then hopefully with that, with an astute therapist, that person would be able to see, oh, there's a little something more going on here. And they may be able to integrate some other techniques and things that would help the family, the couple,
Wow.
or is it a married couple? Is it a, parent-child relationship, adult, child that's, dealing with a parent that's
Yeah.
whatever it might be. So yeah, that could be it because that could actually be helpful, honestly. But in living with a person that's depressed, that's a narcissist, um, we talked about how narcissists often like to burst the bubble. So if you're a very happy, bubbly person normally before getting into a relationship with this person, and then this person sees that you're a little happy and bubbly and they're depressed,
Yes.
happy. Anybody being
Yeah.
happy, they're not happy, right? So
Right.
it definitely has its pluses and minuses here because you want to have um you know harmony in the household, and if somebody's trying to always make it the Debbie Downer kind of thing, that's
Yeah.
that's a hard thing to navigate through. But if
Right.
you get them to agree to getting help because of their depression, that may be the beginning of some type of helpful therapy.
And the interesting thing about what you're saying is that them seeing that light in you shining, maybe even that radiance, and they burst the bubble. It's interesting because isn't that one of the things that attracted them? That like you, that they were attracted to you because of that. But now it's almost like they resent it. Is that like part of the mental illness part of it that is why this is so, like for someone that's on the receiving end of it, they are like, what is going on? They are totally confused
Yeah.
because they're like, so speak to that. Because some people are like in that situation now and they're trying to figure out what is going on here.
Well, yeah, you're right. That is what attracted them to you. And
Yeah.
then, but they usually don't show those signs
Hmm.
immediately. Sometimes they don't show it until after marriage, until there's a
Hmm.
commitment. So it's hard to know. That's why I always tell people make sure that you season a relationship. If this is a romantic relationship, season it, meaning go through at least a full year, winter, spring, summer, fall,
Right.
that you are getting along, and if it's a long distance relationship, you want it to be even longer because you
Mm.
where you don't get to see them as much and you don't know.
Uh,
So, and then of course there are seasonal disorders that people have. So
yeah.
it makes sense to have, for anybody to let their, boarding time, whatever you want to call it, be a little bit lengthy so that you can really get to know this person and see what quirks they might have, and they get to know yours as well.
Yeah.
And you really want to know each other before you make a commitment to do life for the rest of your lives together. If
Yeah.
this person is a narcissist, within that first year, you're going to see some signs. You
Oh, for sure.
might
Hands
ignore
down.
the red flags. I get a lot of people that will have come to see me in the past that say, I saw the red flags and I ignored them.
So Karen, I'm kind of going to go off a little bit. Do you feel like a lot of times the reason why they said they saw the red flags, but they still stayed in it, still married them? Do you think part of that could be when you're in a relationship and you get intimate too soon, or you plug sex into it? And now, because that factor is in play, you're now overlooking things that you probably normally wouldn't have with
Yes,
you weren't intimate with.
yes, yes. Yeah, definitely. That does play into it. There's more of an investment with that
Right.
person. There's an emotional investment. There's also a lot of hormonal things going on in a relationship like that.
Nice.
So there's phenylethylamine, which is the short form of that is called PEA. Uh,
Mhm.
but what that is in any new relationship for the first 2 years, there's a hormone, dopamine as well.
Right.
Those are feel good hormones. God
Mhm.
created us that way so that we would meet someone, fall in love, get married, and it's procreation, right? That's
Yeah.
multiply. so,
Right. That's right.
so God has a good reason for those hormones, but people will wind up before marriage doing things that cause them to have this hormone in their bodies that's dictating how they feel to the point. So phenylethylamine is like so for an addict, a person that's addicted to amphetamines,
Right.
there's a part in the brain that's aroused, and that
Mhm.
wants to continue to get that supply of amphetamine so that they can continue to feel the way they feel.
Right.
Phenylethylamine does the same exact thing in the same area of the brain. And so the
Mhm.
person is now addicted to the physical relationship. So it clouds their wisdom, it clouds their thinking. They're not thinking to themselves right. They're thinking,
Right.
I can't wait to be with this person again. Even when this person, is maybe obviously not good for them. So
Right. Oh, and that's the danger of not doing it God's way and having premarital sex, because that is not something you can turn off. That is something that once it's turned on, it's on.
yeah.
You have done this with this person, and now you have those connected feelings to them, and it's it makes it harder to separate from that, and you'll stay in a toxic relationship longer, even with seeing the signs. So you mentioned depression. What about some other things like, maybe they're kind of up one minute, down the next. You just don't know which way. You don't even know how to approach them because you don't know if they're going to be on a good day or a bad day. So how do you deal with that?
Right, right. That's more like a borderline. I'm sorry, a bipolar
Mhm.
person. The up and down that happens, and so yeah. So your drama that's created by the narcissist is now amped up a bit more because now you're also dealing with whatever the mood swings are, right? So you can
Right.
have somebody that's depressed 1 minute to the point where they could care less what you do, and then they're manic the next minute and they want you to be just as hyper and ready, or in their mania, is their mania more of an aggressiveness, and so can it can manifest in different ways for people. So you know there that's actually that co-occurring situation uh,
Yeah.
and make it more of a challenge for the person that's dealing with the narcissist.
Yeah, because they could be maybe one minute, like you said, they don't care what you do. The next minute, they want to control every move. Well, you're not going there. You're not going to do that. Or why are you going there? And they're questioning and even trying to plant seeds of like, okay, maybe you're doing something you're not supposed to do because why are you trying to go out and do this or
Right.
go here or there? So then
Project.
you start getting the accusations, the projection, right?
Mhm.
So those things start to happen. So, you have that. And then I know that you mentioned borderline. I know you weren't going to speak to it at first, but I want you to go into that as well, just in case somebody may be dealing with someone that's borderline, because I don't feel like that was said by accident. It was intention because someone needs to hear it. So how does a person know that you're dealing with a borderline person that has the narcissistic traits or narcissistic personality disorder?
Well, so usually there's one. in a situation where the cluster B
Yeah.
are so narcissistic personality disorder, and borderline, they're on the same cluster. And
Okay.
what that means, if you can kind of look at like three circles intersecting with each
Yeah.
other, there's a portion that they all share.
Yes. Yes.
So with that, the narcissist may have some borderline tendencies, and the borderline person could have some narcissistic tendencies. And if we think about it, we all have some narcissistic tendencies, right?
Right.
But in their cases, it'd be more pronounced.
It's amplified. Yeah. It's way more than a normal person. Right.
So, one of the things that I see as a common thing for people with borderline personality disorder, because of the upbringing that they've gone through. Now, everybody that's got a personality disorder has had some kind of trauma. Doesn't necessarily have to be a capital T trauma. Could be a
Right.
lot of like little T trauma, whereas like little traumas throughout their young lives that kind of influenced how they've become. The thing to consider is that the characteristics or the traits that come out in these different things, they may be overlapping. So a
Right.
person that's a narcissist may have the tendency to do some things that the borderline person might do. Borderline people, they tend to be fearful and not so trusting of people because they've been hurt a lot. And so
Mhm.
do is oftentimes they'll start to get close to someone, and then
Mhm.
they'll tend to push them away because they don't trust that they're really loved by that person.
Mm.
Like that person has to come after them, because
Oh.
if they come after me, then I'm worth it. Then they really do love me. So it's almost like they need validation, and they need encouragement to stay in that relationship because they've been hurt.
Yeah.
So the narcissist may also do that push pull.
Mm.
Some of that might happen.
It's like proving your love to me. Like I need you to prove, your love.
Right.
Mm. And does that ever end? So if you're in that push pull constantly in that, I want the viewers to know. So explain to them this may never end. This may be something, if you're married to them or you're in a relationship with them, that this may be a lifelong
Hmm.
thing that you have to deal with. Like you constantly have to pursue them. You have to constantly say you love them and I care for you. And oh, I wouldn't do that. And it's like always constantly having.
Right, right. And so for the narcissist that's got that as like a co-recurring disorder, I would say it's probably more intense when it's coming from a narcissist, because I have seen some more mild cases of people with borderline that do the push pull. And oftentimes, I can't say this in all situations, it's not true, but in some I've seen and I've worked with, I've seen that they have done less and less of the push pull when they're just borderline, because over time they realize that they are indeed loved by this person in spite of their quirks. They're still loved by them, and so then that push pull doesn't happen as often, but it's almost like they need that proven to them first before.
Uh,
And yeah, and another thing with a borderline, you know 1 minute you could be their favorite person, and then the next day you could be their worst enemy. So that's also a common thing that both narcissists and borderlines have. So it's just they're wounded people.
yeah. And there's nothing that you have done. This could be something triggered this. And you may never really know what all the triggers are. Is that correct? Like, because you don't know what could set them off to make them start acting in the way that they're acting towards you.
Right, right. And interestingly, even in other types of conditions with diagnoses, like let's just say dissociative identity disorder, which is used to be
Right.
multiple personality disorder. you know
Mhm.
it's not until sometimes persons in their 30s and 40s, maybe even their 50s, that they start to have memories of childhood trauma that
Right.
they remember. And so, throw that into the mix with someone that's a narcissist, and
Mm.
now you do something that triggers that memory that they totally forgot about. Yeah.
Right. Because that could have been buried so deep. And then you did something. And then you're like, whoa, there was this blow up. It was these accusations. They kind of go off. And you're like, where did this come from?
Mhm.
And if that onset does happen later in life, what does a person that's on the receiving end need to do? Because you could have invested and be married to this person maybe a good 10 years or however long you've been with this person, and now this is coming up. What do you recommend in how they navigate these things? Because that's a tough pill to swallow, that this person was kind of fine and then all of a sudden this thing happened and now they're almost a totally different person, or maybe even worse than what they were before.
Right. Well, then you would really want that person to go get help from somebody that understands how to work with people that have dissociation. So,
Right.
there's a lot of ministries as well as therapists that work with dissociative identity disorder, dissociative fugue, which is like basically um, finding yourself in another place, like almost like you hyperspace there, but like
Wow.
you weren't conscious, and then all of a sudden you are conscious. So there's a lot of different, you know, things that could be co-occurring that have to do with dissociation. And so I would say in that case, don't concentrate on the narcissistic issues. Concentrate
Right.
more on the dissociation and what's coming up now. What are these flashbacks that are happening, or what are these memories that are coming up? And so, you want to be able to help the person as a whole, but the narcissistic part of them is not going to want the help. But the part of them that's dissociating and now all of a sudden having these memories come up, that person's going to probably want help. So
So what do you do? So sometimes I know we mentioned the childhood trauma, but what about even a trauma from, let's say if you had a job that was pretty tough. We know jobs in law enforcement is tough, jobs in the military are tough, and you could bury things, feelings, and thoughts because you had to in order to survive and to keep going.
exactly.
So how do you navigate that? Because it may be come off as a little more aggressive, you know what I mean, just because of the type of environment and job that they used to have. So it could come off maybe a little bit more aggressive. I'm trying to think of a better word to use, but how do you help them? Because sometimes I've been around a lot of Vietnam vets and people, and they will not talk about it. Things will happen, they'll blow up, they'll whatever, and they will not talk about what has happened, or they won't divulge or really get into it. So how do you help them?
Right, right. Well, now are these people that you're asking about also we talking about that with narcissists or just on
With narcissism, yeah, they have those narcissistic tendencies as well.
well, I think it's always easier to focus on the second condition than whatever that is.
Second condition. Okay.
Yeah. So if like we know they're narcissists, but now they've also got post-traumatic stress disorder. Like
Right.
the things that have not, and maybe they're starting to have nightmares because they're remembering stuff.
Right.
If that could be so those are areas where most people, if they're going to go for therapy, if they're interested in therapy, they'll be more apt to going for that than going because they think they're the problem because they're a narcissist. So
Right.
always going toward, let's get a therapist to help you with that issue, your nightmares or whatever. And so there's some really great treatments out there for people like that. And if you have an astute therapist that's doing EMDR, which is the eye movement techniques,
Yes.
if they're doing that, they may actually go as far back as the childhood too. Just and in
Mm.
that they could possibly be helping the narcissist.
Wow.
Part of them that's a narcissist because now remember we said that for a personality disorder to develop, there's usually traumas, whether they're big or little, there's traumas, right? So if they can get them talking about their childhood and some of the things that may have gone on there, they could actually be applying some healing to both issues, the nightmares, the PTSD, but also whatever
Right.
that trauma was that brought on the narcissistic tendencies or the narcissist.
Wow, Karen, I think we have really helped some people. Maybe we even cracked the code, honestly, because we talk about narcissism all the time, but these co-occurring conditions that coincide with it. If you've been trying to get them to go into therapy, maybe you can use that other condition to get them into therapy and then get them the help for that secondary, right?
Mhm.
And then the therapist, if you have a good one, they can get to that narcissistic part once it
Mhm.
gets to a good place.
Right.
So I am so thankful we talked about this today. And viewers, if you loved it, make sure you put a heart, like, everything, comment, just say thank you. And share this with someone, because there are people who are dealing with this. Share this with them, because this is something that you don't hear all the time and in different spaces. And we're talking about it today. So, Karen, do you have any last words, anything that you want to share with the viewers, some encouragement, some hope, in regards to people who have family members, loved ones, people they're in relationship with that are narcissists and have other conditions, and they are trying to their best to just be a support and be there for them and have a relationship with them?
Sure. I think, of course, always be prayerful before you would seek, any type of help from the outside.
Yeah.
Ask to give you the right match for your person that you're praying for, that
Yes.
that would know the details of therapy that they need to know so that they can be the best help for your particular person. um and also, just ask God for wisdom on how to, navigate through this. It's a tough road, but if you love this person, you want them better, you want your relationship to be better, you want their life to be better, your life to be better. So looking out for, them in a way where maybe they wouldn't even know how to advocate for themselves. This is mental,
Exactly.
and mental illness, I think, always those words, mental illness, sounds like,
Yeah.
crazy. It's not crazy. Things happen to people, things happen to all of us in our lives, and depending on the severity of these things, it will create different knee-jerk reactions and ways of coping. And so a narcissist has learned ways of coping, and
Right.
now you throw into that somebody that's, been through any kind of combat, and
Yeah.
now they've got the PTSD on top of it.
Yeah.
So, you just got to be praying that this person gets the help so that they can have more peace in their lives. It's all about, you know, gaining peace, not just for them, but for you as well. Uh,
Right.
but it's all a part of it. So I would just say, be prayerful, and just ask God to help you be connected to the right people so that help can come.
That's right. Always want to ask God for that help, and He will give you that help. He will put the right people in place. So, these are the type of things you want to make sure you're sharing and getting the word out, because there are people who are suffering in silence. That's what I would say is they're suffering in silence. They don't know the battles that are going on in their mind. They can't figure it out, but you on the outside looking in can see it. So you can be that hope. You can be that lifeline that they need to help them to get to where they need to be, so that they can get healthier for you, for them, and for everyone else that they're around. Because
Right.
when
Yeah.
they have those issues, it affects everyone. It's not just them. Well,
Yes.
I appreciate it, Karen. We did. This was so good. And remember, don't keep this to yourself. Share it with someone. Remember to subscribe to the podcast and the YouTube channel. That way you can get the notifications as the new episodes come up. And just wanted to thank you again. My name is Tyler King. My co-host Karen Maldonado, and we're here at the podcast Narcissist Asking for a Friend. And we'll see you on the next episode.